A new law aims to give nurses a break when it comes to mandatory overtime. 22 News State House reporter Christine Lee explains how the law is controversial among nurse groups.
Massachusetts passed a healthcare reform law last year that limits mandatory overtime for nurses. But different nurse groups have conflicting opinions on how those limits should be defined.
I worked as an evening nurse for 6 years, and there was many times where I worked 17-hour, 16-hour shifts.
Some Western Massachusetts nurses say they're overworked and jeopardizing patient safety. As part of a health care reform law passed last year, the Massachusetts Health Policy Commission has proposed guidelines to limit mandatory overtime for nurses. Some nurse groups approve.
We support the guidelines as they're currently drafted. We absolutely agree that mandatory overtime should never be used as a routine staffing strategy and should only be employed in a case of a patient care emergency or a disaster.
The guidelines say mandatory overtime can only be required during a government declaration of emergency, catastrophic event, or patient care emergency. But the Massachusetts Nurses Association says there are loopholes.
Hospitals are staffing to bare bones. There are not enough nurses to be in place and at the ready to take care of patients when emergencies arise.
The MNA wants hospitals to have adequate staff when mandatory overtime is typically required, such as during ongoing patient surgeries and predictable disease outbreaks like the flu. Ultimately, they want nurses to be able to volunteer or refuse overtime work. The Massachusetts Health Policy Commission is conducting a statewide listening tour. They're scheduled to release final mandatory overtime guidelines for nurses on June 19th. At the State House, Christine Lee, 22 News.